coming to the duct system of female reproductive organs, we have to understand these uterine tubes, that is called as the fallopian tubes, then uterus and the vaginal cavity. These are all the tubular structures that we are going to discuss. Okay, you know the location of this ovary that is present in the pelvis. Okay, the ovary is present in the pelvis, and this ovary is not in contact with the female duct, I mean the fallopian tube. Okay, if you look the fallopian tube very closely, you can see this fallopian tube. They are just like adjacent structures. You see, this is the ovary. Okay, so this ovary, this is the place where the ovulation is taking place. This is the outer cortex of the ovary. This is the outer cortex of the ovary, and you can see the fimbriae here. You can see the fimbriae. Okay, these finger-like projections are called as a fimbriae. So once the ovum is released, this ovum is picked by this fimbriae and it is sent to the fallopian tube. The epithelium of the mucosa is very special. I will tell you, we will discuss this when we are discussing about this fallopian tube. Okay, so coming to the duct system, the ducts, that is the fallopian tube, doesn't have any contact with the ovary. Okay, so the oocyte fall into the ovum cell that is falling into the peritoneal cavity, and this peritoneal cavity, the fimbriae movements of the ovary will catch this is the fimbriae movement of the fimbriae movement of the fallopian tube will catch the oocyte, that is the ovum cell, and send it to the fallopian tube. Okay, let's have a few words about this fallopian tube. The fallopian tube is connected to this uterine wall. The fallopian tube is connected to the uterine wall, and this is the parts of the fallopian tube, that is the isthmus, ampulla, and the infundibulum, and the finger-like projection are called as the fimbriae of the fallopian tube. Okay, this ampulla of the fallopian tube is a common site for fertilization. Okay, and this is the place where the sperm cell comes and meets the ovum cell here, and fertilization is taking place. Okay, so we have to understand about the ciliary movements. What is this ciliary movement? Okay, so you know what, if you look at the epithelium of the fallopian tube, you have lots of cilia, that is hair follicles. Okay, just a minute. See, the this ovum is made up of, the fallopian tube is made up of ciliated columnar epithelial cells. You can see this is the columnar epithelial cells, and you can see the fine cilia. Okay, you can see the fine cilia that is present in the superficial layer of the fallopian tube. This is the ciliated columnar epithelium. You can see this is a ciliary movement. You see, this is the hair-like movement that is taking place in the fallopian tube. Okay, so in this cilia, around this cilia, the ampulla, the fallopian tube, in the ampulla of fallopian tube, the ovum is present, and the sperm cell will go and fuse with it, with the ovum. Okay, so after that, this cilia, that is the hair follicles like structure, this is a hair follicle. Okay, so this cilia will keep moving the zygote, I mean when the sperm cell and ovum cell unite, this cilia will keep moving the zygote towards the uterus. Okay, so why I am telling this, giving more importance for this, because if this ciliary movement is absent, the zygote will stay in the fallopian tube, or the zygote will jump back into the peritoneal cavity, and the embryo starts to develop into the fallopian, I mean the peritoneal cavity. Okay, the fetus will not be present in the uterus, it will be present in the peritoneal cavity. Okay, so in fact I have done a research in Africa about this ectopic pregnancy. We call that as ectopic pregnancy. So there was a baby which completely developed full term in the peritoneal cavity, not in the uterus, and we don't know. And when the last moment, when the female start to have delayed pregnancy, then when we scanned, the fetus is in a peritoneal cavity. Okay, then the baby died, in fact. So there was an article, you can search in the name, I will give you the article link. Okay, we published this article in the paper also. Okay, now in this you have to understand about the ciliary movement. If this ciliary movement is not present, the fetus will develop in the fallopian tube. Within 1 week, the fallopian tube will rupture and cause severe amount of bleeding. We call that as tubal pregnancy. Okay, so that is the importance of the fallopian tube. The peristaltic movement and the ciliary movement will keep pushing the ovum towards the uterine cavity. Okay, so the mesosalpinx, that is a mesentery that supports the uterine tube. So now we have to understand this is the mesosalpinx. I will show you in the model, you will be able to have a better understanding. Okay, so if you look at this connective tissue here, okay, not this. Peritoneal sheath sac covering on the uterus and the bladder and the fallopian tube, we call that as mesosalpinx. You see, this is the mesosalpinx, that is a peritoneal sheath that is covering the whole fallopian tube. Okay, this is called as a mesosalpinx. I will isolate this. You can see this is a fallopian tube, and the peritoneal sheath is just covering the ovary, the fallopian tube, and also it is going in between the. So this is a broad ligament. I will show you, if you have to understand in a 3D view, the broad ligament. Okay, so this is a mesosalpinx that covers the fallopian tube and gives support for the fallopian tube. So as I told you, the different parts, this is the isthmus of the fallopian tube, this is the ampulla of the fallopian tube where the fertilization is taking place, and this is the infundibulum of the fallopian tube, and this finger like position is called as a fimbriae. Okay, so coming to the uterus is a muscular pouch. We can call it as a muscular pouch made up of smooth muscles. Okay, there are 3 layers of the uterus: outer perimetrium, middle myometrium, and inner endometrium. These are the 3 layers of the uterus. I am going to remove the uterus and show you separately. Okay, so I will remove the bladder also, so that you can see the uterus clearly. Okay, okay, so what you see here is the normal anatomical position of the uterus. Okay, the outermost layer of the uterus is called as a perimetrium. Okay, so that is covered by this thick band of connective tissue sheath. Okay, so once you cut, you can see the muscular layer in the uterus. This muscular part is called as the myometrium of the uterus. This is the myometrium of the uterus, and this part is called as this innermost layer is called as the endometrium of the uterus. Endometrium of the uterus. Okay, so if you look at this myometrium, this myometrium muscle is a smooth muscle, and you can see it is the uterus is the size of 4 finger breadth. Okay, but during the time of pregnancy, the fundus of the uterus comes up to the epigastric level of the abdomen, this is epigastric level. Okay, from here the uterus keeps expanding because it has to accommodate the fetus as well as the amniotic fluid as well as the placenta. Okay, so this is so imagine the muscle has to stretch, and along with that muscle there is a thick connective tissue on the outer layer that's called as a perimetrium, that also has to stretch. Okay, suppose if in the first pregnancy, if a female is having cesarean section, what they do, they cut the uterine muscles and remove the fetus out and they suture. Okay, so when the female goes for a second child, they don't conduct normal delivery. For second child also we are going to make cesarean section and remove the baby out. Otherwise what will happen, there are chances of rupture of this uterus when during the time of contraction at the time of pregnancy. Okay, that is why the surgical removal is done for the second baby also if a female has first C-section baby. Okay, so now you see the upper part of the uterus is called as a fundus of the uterus, and this is the body of the uterus, and this is the cervix of the uterus. Okay, and inside you have the endometrium, innermost layer, which is forming the uterine cavity. This is the uterine cavity, which is the endometrium, that is made up of these columnar cells. Okay, so now I am going to show you the cervix part. This is a body part, and this topmost, this area is the fundus part. And now what I will do, and this part is called as the cervix of the uterus. Okay, and this junction is called as the cervical os. The cervical os. Okay, this os remains closed. Cervical os, it remains closed. Okay, so what happens, the fertilization takes place here, and it comes and falls here or here or here. Okay, if imagine this is the I think I am taking a lot of time, no problem, because this nursing students is important subject for maternity. Okay, so you have to learn. Okay, so this is the cervical endometrial cavity. Okay, suppose if the fetus comes here and falls in this junction, what happens, the placenta will come here, the baby will grow like this. The umbilical cord and placenta will come here, and the baby will come first, then followed by the placenta. Suppose if the embryo, that is zygote, attaches here, the placenta will form here, and the umbilical cord and the baby will be here, growing like this. So during the time of delivery, baby will come first, then the placenta will come. Suppose if the embryo falls here, what happens, the placenta will grow here, then the umbilical cord and the baby will grow in this aspect. So during the time of the delivery, first the placenta will come, then the followed by baby will be delivered. So when the placenta comes first, that is forming a lot of blood vessel network. So what happens, the mother will die because of severe bleeding. Okay, so this is called as a placenta previa. This condition is called as placenta previa. So you have after 3 months you will be going for ultrasound scan to see the position of the baby. So by doing ultrasound, we will know what is the position of the baby, growth of the baby, when the baby will be delivered. A lot of calculations are there. Okay, so just know the importance of this cervical os here. Understand? Okay, now coming to the uterus, it has a body, the major portion. The fundus is the upper part, and the isthmus is the narrow region. Okay, this is a cervical os. Os means opening. Okay, and this is a vaginal, connected to the vaginal cavity. So there are 3 layers of the uterus: perimetrium, outermost layer; myometrium, the smooth muscle layer, which contracts during the time of childbirth. Once the oxytocin is released, okay, in the posterior pituitary. Then the myometrium contracts and start to push the baby out. Then endometrium, that is a mucosal layer. So this endometrium will go for if the endometrium is thick, it doesn't allow the implant of the embryo. Okay, so the stratum function. Stratum is the endometrial cells. Okay, that is the outer epithelial cells that changes in response to ovarian hormone cycle is shed during the menstruation. Okay, so yesterday I have shown you a graph like how during the time menstrual cycle, how the mucus builds, how the spiral artery forms, and how the thickening of the mucosa takes place. And in the last 4 days of menstrual cycle, how this mucus is breaking down and coming out. Okay, then the basal layer forms the new layer after menstruation. It is unresponsive to ovarian hormones. Okay, now you can see this is the mucosal build up during the time of menstrual cycle, not menstrual cycle, in the second phase. Okay, so stratum, this is how the mucus develops every month, and there will be presence of spiral arteries in this mucus. So once the embryo comes and implants, then it buries here and starts to grow out. So in embryology we will study how the outer cell mass becomes the placenta, how the inner cell mass becomes the fetus. There are many stages, many developmental aspects you have to understand. Okay, these are all the uterine glands. Okay, this is the endometrium. Now coming to the cervix. A cervix is a narrow neck-like region or outer projects into the vagina. Cervical canal communicates with the vagina via the external os, uterine body, and the internal os. Okay, so you know what, clinically this junction is very important. Clinically this junction is very important. I will tell you why. Okay, in the vaginal cavity, that is called as a birth canal. The vaginal cavity is called as a birth canal. There are lots of folds. We call it as a rugae. Okay, so if you look at the epithelium of this place, you see this uterine cavity is made up of columnar epithelial cells, whereas the vaginal cavity is made up of squamous epithelial cells. So what happens here exactly in the cervical os? The squamous epithelial cells meet the columnar epithelial cells. This junction is called as transition zone or squamo-columnar junction. Okay, I told you wherever different types of epithelial cells meet, there will be conflicts. That means what? This is a common site for origin of cervical cancer. Okay, this is the common site for origin of cervical cancer. As you know, this human papillovirus, they do come and trigger the cancer here, or this family persons with family history of cancer, they have this cancer proliferation in this junction. So what happens? We have to scrap this area and in cytology study and see for cancer cells. Okay, or we take a cone biopsy here and then we send the tissue for, we cut the tissue like a cone here, and we send the tissue for microscopic examination to see if there is any cancer proliferation. Okay, so this is called as a transition zone, that is the columnar epithelium merging with the squamous epithelium, also called as squamo-columnar junction in the cervical os, which is the common site for cancer origin, which is a common site for cancer origin. You can see this. Okay, so the mucosa near the vaginal orifice forms an incomplete partition called as a hymen. Okay, there is a small membrane, that is a hymen. So this hymen ruptures during the time of sexual intercourse, or during the time of severe exercise, or during the time of cycling, playing football, or any long jump. Like this kind of physical activity will lead to rupture of this hymen membrane. Okay, so and also the sexual intercourse can lead to rupture of this hymen membrane. Okay, so the vaginal pharynx, that is the opening in the cervical region, its upper end of the vaginal cavity surrounded by the cervix. This junction is called as a vaginal pharynx. Okay, so what happens? This you can see closely here. This is the peritoneal sac that is lying on the uterus and also the bladder. So this, if you know, if there is any infection accumulation here, you in a PV examination, you place the finger here and see if there is high temperature, you insert a needle here and take the fluid sample, because this pouch is called as a vesicouterine pouch, or also called as pouch of Douglas. Okay, or in case if there is a more amount of endometrial tissue going through this fallopian tube and dropping into the peritoneum, so what happens, they come and accumulate here and here, so that condition is and leading to fibrosis. This condition is called as endometriosis. This condition is called as endometriosis. Okay, so this vaginal cavity acts as a birth canal and also the organ of copulation. Okay, so now coming to the ligaments that is supporting the uterus. You know what, there are many patients who have uterine prolapse, that is the uterus will prolapse outside through the perineum. Okay, when they cough, when they lift heavy weight, the uterus will try to prolapse out. So this uterus is well supported by the ligaments. If you find the ligaments that is present around the uterus, one is a ovarian ligament that is supporting the ovary. Okay, next is a broad ligament. This is the broad ligament. It consists of mesosalpinx and the mesometrium. They are nothing but the fold. I showed you the 3D image. They are nothing but the fold of the peritoneal sac, and that is present broad by the side of the uterus. That's why it's called as the broad ligament, and it is supporting the uterine blood vessels also. Okay, and there is a round ligament. This round ligament, this is the round ligament. This is connected between the uterus and the like, you know, if you look at the round ligament in the 3D format, this is the round ligament. You can see the, you know, this round ligament is a fetal remnant. Okay, in the male, this round ligament is acting as a the spermatic cord, whereas this round ligament fuses. There is no need of blood vessels to come here. So what happens, they come and fuse and become a ligamentous tissue in the deep and superficial inguinal ring in the anterior aspect of the pubis. Okay, so there is no much function except to support the uterine body of the uterus. Okay, so these are all the ligaments, and also there is uterosacral ligaments. Okay, these uterosacral ligaments are nothing but the ligament that is attached between the uterus and the sacrum. It is attached between the uterus and the sacrum. The uterosacral ligament is present there. Okay, next, these are various parts of the duct system of the female reproductive system. Let's go to the external genitalia. So we call it as vulva. You know what, there are mons pubis, then clitoris, that is compared to the glans penis of the male. Okay, that is compared to the glans penis of the male. So in the male, the scrotal sac is present. That scrotal sac folds and forms the labia majora and labia minora in the female. Okay, the labia majora is the skin that is present in the external female genitalia. But one thing you have to understand, like the Cowper's gland, that is the bulbourethral gland in the male, you also have the Bartholin's gland. I am going to show you. You see, if you see, this is the bulb of the vestibule, and this is the labia minora. Okay, so if you remove this labia minora, you have this Bartholin's gland. This is also called a vestibular gland. Okay, so what happens here, this Bartholin gland can create a cyst. Okay, there is a condition called Bartholin cyst. So suppose in the female vaginal os, if there is a swelling in the 8 o'clock and the 4 o'clock position, it is nothing but Bartholin cyst. It is nothing but Bartholin cyst. This gland will secrete the secretions into vaginal cavity to lubricate the vaginal cavity. Okay, so this is nothing but the Bartholin's gland, which also you can Google it, Bartholin cyst. There will be a swelling in the side of the vaginal os, especially in this timing. So here you have 12 o'clock, 6 o'clock, 3 o'clock and 9 o'clock. So between 8 o'clock and 4 o'clock position, if you have a swelling and pain, it is nothing but the Bartholin cyst. Okay, next, if you see this vestibule is compared to the the seminal vesicle of the female, and this clitoris is compared to the glans penis of the male, and this crus of the clitoris is compared to the corpora spongiosum of the male, the cylindrical body of the. So this is also extending in the side of the inferior pubic ramus. Okay, so during the time of sexual intercourse, the blood will fill in this and it will enlarge like the male penis enlargement. So this is the vascular, it is having a lot of vascular blood vessel network. Okay, so this is how the male reproductive organ is compared to the female reproductive organ. Okay, so there is a slight change in sense the uterus, vagina are different in male and female. I mean, female has uterus and vagina, the male have this prostate gland and other seminal vesicle and all this stuff. Okay, so this is how you have to compare between the male and the female reproductive organs. Okay, next, coming to the ovarian cycle. As I told you, what are all the cyclical changes that is taking place in the ovary in the first in the 28-day cycle. Okay, so first phase, we call it as follicular phase, then luteal phase. The follicular phase is 1 to 14 days, luteal phase is 14 to 28 days. Okay, so only 10 to 15% of the women have 28-day cycle. So in ovarian cycle, what happens? The superficial layer, the outermost layer of the ovary, we call it as the this is the place where the oocytes are located. Okay, there are around 300 to 400 oocytes in every single ovary. So every 28 days, one oocyte will start to develop. Okay, by the hormonal action, one oocyte will start to develop and they keep migrating. You know what? So these are the various stages. This is a primary oocyte, then this is a secondary oocyte. Okay, so what happens here? If you look at the layers of the ovary, ovarian follicle, you have the zona pellucida. Okay, and there is a fluid around the zona pellucida. So exactly on the 14th day of the menstrual cycle, this membrane, outermost layer membrane, will rupture and the fluid comes out along with the ovum cell. This is the egg. Okay, so the remaining tissue will start to change into yellow color, and that tissue is named as the corpus luteum, which starts to secrete the progesterone. Okay, for the remaining second phase of the menstrual cycle. Okay, so this is how the primary follicle look like, and this is how the primordial before the maturation. This is how the primordial follicle look like, and this is how the primary follicle look like. You see, there is more amount of fluid collection around. Okay, and the secondary follicle, more amount of fluid is collecting and the ovum is present in the center. Okay, so this maturation is taking place by the release of follicle stimulating hormone in the anterior pituitary. Okay, so the secondary follicle becomes late secondary follicle. Then there are presence of connective tissue and epithelial cells. The inner thecal cells produce androgen in response to luteinizing hormone. The zona pellucida is the outermost layer of the oocyte, and there is fluid accumulation around it. Okay, so in the late secondary follicle, it becomes vesicular follicle, Vesicular follicle bulges from external surface of the ovary. The primary oocyte completes meiosis, producing secondary oocyte and the first polar bodies. Okay, and this is a late secondary follicle where there is more amount of fluid and it is ready to come out, and it is ready to come out of the ovary. Okay, so if you look at the mature vesicular follicle, you see the zona pellucida is outermost layer, and that this is a stage in the 14th day of the menstrual cycle. This is a stage in the 14th day of the menstrual cycle. Okay, and the follicle ruptures and the oocyte is coming out. Okay, the follicle will rupture and the oocyte is coming out. So next is the ovarian. In the luteal phase, what happens? That ruptured follicle will change the color into yellow color, and it is taking the name as corpus hemorrhagicum, where there will be little bit of hemorrhage, and that changes into yellow color and takes the name as corpus luteum. So this corpus luteum secretes the progesterone. Okay, so if pregnancy is not happening in the uterus, what happens? This corpus luteum degenerates and changes into corpus albicans. Okay, then it disappears. Okay, whereas if the pregnancy takes place in the uterine cavity, the corpus luteum continues producing the hormone that sustains pregnancy until the placenta takes over for about 3 months. Okay, so this is the corpus luteum, you can see, which will secrete the progesterone. So establishing during childhood, the ovaries grow and secrete small amount of estrogen that inhibits hypothalamic release of GnRH. Okay, that is gonadotrophic releasing hormone. Once the puberty is achieved, once the female reaches the puberty age, the gonadotrophic releasing hormone is released in the hypothalamus, that comes and makes the pituitary to secrete follicle stimulating hormone, luteinizing hormone, and those hormones comes and acts on the ovary. So the first menstrual cycle is called as menarche. Okay, the first menstrual cycle in the life is called as the menarche. Okay, so the hormones that is responsible for menstrual cycle is this gonadotrophin releasing hormone, pituitary gonadotrophin, that is the follicle stimulating hormone and luteinizing hormone, then estrogen and progesterone. Okay, these are the hormones that is related to the menstrual cycle. Okay, so during childhood and until puberty, ovary secretes small amount of estrogen. Estrogen will inhibit the release of this gonadotrophin releasing hormone. So if the leptin levels are adequate, hypothalamus is less sensitive to estrogen as puberty nears, then the release of gonadotrophin releasing hormone in rhythmic pulse manner takes place, and thereby leads to release of follicle stimulating hormone and the luteinizing hormone. Thereby the ovary will start to produce estrogen and progesterone. Okay, so and this is the time where the first menopause, first menstrual cycle is taking place. That is what we call it as menarche. That's what we call it as the menarche. Okay, so coming here, for menarche, these follicle stimulating hormone, luteinizing hormone are responsible, that stimulates the ovarian follicles and make them to secrete estrogen and the progesterone in the female body. Okay, so when estrogen levels are high, brief positive feedback on the brain and anterior pituitary takes place, and stored luteinizing hormone and some follicle stimulating hormone is released by the anterior pituitary in the mid cycle, that triggers the ovulation. Okay, so only when the luteinizing hormone is released the 14th day, the ovulation will start. Okay, the ovum, one ovum will live for 48 hours. So there are 4 days of chances of pregnancy in the middle of the menstrual cycle for female. Okay, so you know how luteinizing hormone affects the mid-cycle, increases local vascular permeability, triggers inflammatory response and weakens the ovarian wall, and thereby the ovarian follicle will rupture to release the oocyte. Oocyte is a ovum cell. Oocyte is a ovum cell. After ovulation, estrogen level will reduce, and luteinizing hormone transforms the ruptured follicle and change the ruptured follicle into corpus luteum. This corpus luteum will start to release this progesterone. Okay, so here the negative feedback mechanism will inhibit the luteinizing hormone and follicle stimulating hormone release, thereby inhibiting from corpus luteum and granulosa cells enhances the effect. Okay, so declining luteinizing hormone ends luteal activity that inhibits the follicle development. Okay, if no fertilization, then the this corpus luteum will stop producing the progesterone, and thereby again the next cycle will start. Okay, this is the hormonal activity that is taking place. So you see the gonadotropin releasing hormone is released in the hypothalamus that comes to pituitary, which in fact release follicle stimulating hormone and luteinizing hormone. Follicle stimulating hormone will stimulate the follicles and make the ovary to produce estrogen, whereas luteinizing hormone will come and soften this outer ovarian membrane, and it will make the ovarian follicle to rupture and push the oocyte out. Okay, after that this follicle will change the color and takes the name as corpus luteum that produces progesterone. Okay, that will produce the progesterone. You can see various steps that is happening place. So as I told you, the luteinizing hormone level in the middle of the menstrual cycle will be high, whereas the follicle stimulating hormone level the middle of the menstrual cycle is high. That is the time where the ovulation is taking place. So in first 1 to 10 days this ovarian follicle keeps maturing, and in the 14th day the ovulation will take place. From 14 to 24 days it will be the luteal phase or the progesterone phase, in which the progesterone will produce. The last 4 days, 24, 25, 25, 26, 27, 28 will be the menstrual cycle, where the mucosa in the uterine wall will break and flow out as a menstrual cycle. Okay, these are all various phases in the menstrual phase. You can understand, I have explained you already. Okay, so coming to the this different phases, you should know what are all the changes that is taking place inside the uterus. This I have explained in the beginning. You can follow with that. Okay, and these are all the various if you go to my previous lecture when I was teaching about the menstrual cycle, I have shown you all how the mucus build takes place, how the spiral artery is formed, and how the implant is received, and how it sticks to the uterine wall and start the embryo development. Okay, so first phase is proliferative phase, secretory phase, and third phase is a menstrual phase. But in this diagram they have started with the menstrual cycle, followed by proliferative phase, and then the secretory phase. This is called as a free period, that is there is no chance of fertilization in this, because the ovum will not be available. Only on the 14th day the ovum is released, and thereby there are chances of fertilization. So in this secretory phase only there are chances of female to have to conceive the child. Okay, so this phase is called as a free period, where the couple can have unprotected sex, whereas in secretory phase if they have unprotected sex it will lead to conception if the fertilization does not take place. So what happens, the corpus luteum degenerates towards the end of the secretory phase and takes a name as corpus albicans. Okay, that is nothing but the scar tissue. This will remain as a scar tissue, and this progesterone level will fall down, and spiral arteries that is formed in the endometrial wall along with the mucus will start to break down, and thereby the breakdown of mucus is taking place inside the endometrium and start to flow out as a menstrual cycle. Okay, you know what? So one thing you have to understand is the ovary is a highly vascular organ. So So if you look at the ovarian cyst, and it is having a very good amount of thick the outermost connective tissue layer is very strong. Okay, so if you look at this picture of the ovarian cancer, there is a lot it can grow abnormally, it can grow very in abnormal size. I will show you this picture. This surgeon is carrying this ovarian cyst, which is around 50 pound. Okay, that means what? The ovary tumor can grow this much big size. The tumor of the ovary can grow this big size. You can see these are all the different size of ovarian tumor. These are all the different size of ovarian tumor. So how the ovary is capable of enlarging this big size? Because of the connective tissue that is present outside the ovary. The connective tissue outside the ovary is very big. The connective tissue outside the ovary is very big and very strong, and that's why the ovary can enlarge to this size. Okay, and there is rich vascular supply to the ovary with the ovarian artery, and thereby the cells keeps multiplying and it can grow as a benign. Benign means which the cancer doesn't spread to other part of the body, so it can grow as a benign ovarian tumor. This is what you have to understand about the ovary. Okay, so coming to the functions of the estrogen. The estrogen plays a main role in production of oocyte. That is, oogenesis means formation of ovum cell. Okay, and also the follicle growth on the outer layer of the ovary. Okay, it exerts anabolic effect on female reproductive tract. It exerts anabolic effect on female reproductive tract, and it supports the rapid but short-lived growth spurt at puberty. Okay, now if you look at the other effects of estrogen, so the secondary sexual characteristics like development of breast mass, increased deposit of subcutaneous fat, okay, widening of the pelvis, all these are due to estrogen effect. Okay, then metabolic effects are present. Maintains a low blood cholesterol and high density lipid level. Then facilitate calcium uptake. So what happens, the female until the menopause, they will have good calcium absorption from the food. Okay, after menopause, if the estrogen is not produced in the female body, what happens, the calcium uptake level is reduced, and thereby the female bones go for osteoporosis. After menopause, they lose a lot of calcium and the female bones become soft, and there are high chances of fracture of bones for female due to less calcium uptake due to lack of estrogen. Because only when the estrogen progesterone is present, menstrual cycle will be present. In menopause, what happens, this menstrual cycle is absent and there is no estrogen level, so that's why they lose calcium and they are prone for bony fractures. Okay, now if you look at the function of the progesterone works with estrogen to establish and regulate uterine cycle, promotes changes in cervix mucosa, effects of placental progesterone during the pregnancy, inhibits uterine motility, and helps prepare the breast for lactation. These are all the functions of progesterone. Menopause, it takes place around 45 to 50 years age. So what happens in menopause, there will be cessation of menstrual cycle. Okay, so when a female is not having menopause for more than a year, then we have to consider the female as menopaused female. Okay, so in case after 1 year, if suddenly one day a female is getting bleeding, you have to screen the female for cervical cancer, or there can be some endometrial adhesions. Okay, so these things can cause sudden dysfunctional uterine bleeding. We call it as dysfunctional uterine bleeding, and the female have to be screened for or any cancer growth or any other issues with the endometrium. Okay, next thing is, if there is a painful during the time of menstrual cycle, there are multiple, the smooth muscles will go in for cramps. Okay, so we call that condition as dysmenorrhea, that is difficulty during the time of menstruation. Okay, amenorrhea means it is absence of menstrual cycle. So when the female can have amenorrhea, one, if a female is having a hormonal imbalance, then the female can have amenorrhea. Okay, then if a female is having phobia, lot of phobia, then also there are chances of amenorrhea. Then the female will have during the time of pregnancy and lactation, the female will have amenorrhea. So these are all the time where the menstrual cycle is absent. Okay, then you have other infectious conditions that you will study in pathology. Okay, so dysmenorrhea, oligomenorrhea means less menstrual flow, scanty menstrual flow, oligomenorrhea. Okay, this is a condition. Then amenorrhea is absence of menstrual cycle. Okay, so likewise there are many terms that we use for related to menstrual dysfunction. Okay, so by this we are completing the female reproductive system. If you have any doubt, you can write to me. Okay, thank you.